where that is saved. That's at kh.org/caregiver-well-being. So you can find this session as well as many of the other sessions that we have done out there at any time. If you missed one, want to share one with other people, whatever it might be. So the book that we are discussing this week is The Body Keeps the Score, Brain, Mind, and Body in the Healing of Trauma by Bessel van der Kolk. He is a very impressive and amazing psychiatrist. And we're going to get a video from him here in just a second that will summarize the book for us. But again, whether you've read the book or not, we want you to feel comfortable and welcome to please ask or share anything that you would like regarding this book or this topic. So the couple of paragraphs we have here are just a summary of the book. I pulled this right from the back of the book, so you may have already read this, but one of the things that I wanted to highlight here in the summary is that this book is about trauma, and trauma is a fact of life, something that Dr. van der Kolk discovered when he first started working with patients that had experienced trauma, was that they initially thought trauma was exceptional experience, that you were an exception if you had experienced it. But what they learned over time is that it's very common. And so that's one of the things that he talks about a lot during the book, is just the number of people that have experienced this. 1 in 5 Americans have been molested. 1 in 4 grew up with alcoholics. 1 in 3 have engaged in physical violence. Uh-oh. Can you hear me okay? Am I back?
Yes. It came back.
Oh, okay, good. All right. I don't know. That was strange. Thank you. So he spent over 3 decades working with survivors of trauma and really learned not only about how to take care of them through talk and pharmaceuticals, but how to really work with their bodies and mindfulness and really a whole variety of different treatment options for these people. So really a very thorough and engaging book. Dr. Peterson, anything else you would share before we watch the video from Dr. van der Kolk?
Yeah, I mean, I would say, I imagine there's people on the call who have read the book and people who have not. The thing that was the most surprising to me, not having studied really psychiatry after medical school, was how much the body is involved in the effects of trauma. That wasn't something that I had understood prior to reading the book. And I thought that it was really kind of very enlightening as to why it's important to understand trauma when you're working with people who have experienced it, which is, the majority of the population, I would say, has experienced trauma in some shape or form. But yeah, so excellent summary. Just my 2 cents. Thank you.
All right. Thanks. So we're going to go ahead and watch a video that will help tee up our conversation, and then we'll get started with our discussion. Video is about 8 minutes long. It's a little bit on the longer side, but gosh, it is just so great when we get an opportunity to hear from the author directly. So here we go. Let me know if you can't hear it.
The most important thing to know is that there's a difference between trauma and stress. As I like to say to people, life sucks a good amount of the time. We all have jobs and situations that are really unpleasant. But the moment that the situation is over, it's over. The problem with trauma is that when it's over, your body continues to relive it. My name is Bessel van der Kolk. I'm a psychiatrist, neuroscientist, and author of the book, The Body Keeps the Score. This is in trauma on my first day working at the Veterans Administration. 1978 was the year, and the Vietnam War was over by about 6 or 7 years. The very first day that I met Vietnam veterans, I was just blown away. These were guys who were my age, who were clearly smart and competent and athletic, and they clearly were just a shadow of their former self. Their bodies were clearly affected by trauma, and they had a very hard time connecting with new people after the war. Around that time, a group of us started to define what trauma is. And in the definition of PTSD, we write, these people have been exposed to an extraordinary event that's outside of normal human experience. In retrospect, that shows us how ignorant and narrow-minded we were, because it turned out that this is not an unusual experience at all. People usually think about the military when they talk about trauma, but at least 1 out of 8 kids in America witness physical violence between their parents. A larger number of kids get beaten very hard by their own caregivers. A very large number of people in general, but women in particular, have sexual experiences that were clearly unwanted and that left them confused and enraged. So, unlike what we first thought, trauma is actually extremely common. There's a lot of debate of what the trauma is to this day. But basically, trauma is something that happens to you that makes you so upset that it overwhelms you. There is nothing you can do to stave off the inevitable. You basically collapse in a state of confusion, maybe rage, because you are unable to function in the face of this particular threat. But the trauma is not the event that happens, the trauma is how you respond to it. One of the largest mitigating factors against getting traumatized is who is there for you at that particular time. When, as a kid, you get bitten by a dog, it's really very scary and very nasty. But if your parents pick you up and say, "Oh, I see that you're really in bad shape, let me help you," that dog bite doesn't become a big issue because the foundation of your safety has not been destroyed. We are profoundly interdependent people, and as long as our relationships are intact, by and large, we're pretty good with trauma. It's a subjective experience, and what may be traumatic for you may not be traumatic for me, depending on our personality and our prior experiences. The problem with trauma is that it starts off with something that happens to us, but that's not where it stops, because it changes your brain. Much of the imprint of trauma is in that very primitive survival part of your brain that I like to call the cockroach brain. There's a part of you that just picks up what's dangerous and what's safe. And when you're traumatized, that little part of your brain, which is usually very quiet, continues to just send messages. I'm in danger. I'm not safe. That event itself is over, but you continue to react to things as if you're in danger. We're talking about survival. We're talking about staying alive. And so some people go into fight flight, or on a more primitive level, people's brain shuts down and they collapse. You have these automatic responses that are not a product of your cognitive assessment, they're a product of your animal brain trying to stay alive in the face of something that that part of your brain interprets as a life threat. And the problem then becomes that you are not able to engage or to learn or to see other people's point of view, or to coordinate your feelings with your thinking. Traumatized people have a tremendous problem experiencing pleasure and joy. But the core issue is our hormones and our physiological impulses that have to do with survival. Your body keeps mobilizing itself to fight. You have all kinds of immunological abnormalities, endocrine abnormalities, and that really devastates your physical health also. Oftentimes the physical problems are longer lasting than the mental problems. And the other thing that is terribly important is the impact of poverty, or the impact of racism, or the impact of unemployment. There's other societies that are much more trauma savvy than we are, where there is not an enormous amount of income inequality. Healthcare is universal, childcare is universal. A culture like that really looks at what are the antecedents for certain forms of pathology. So the big issue is a political issue. How do we rearrange our society to really know about trauma so that people who grow up under extreme adverse conditions can become full-fledged members of society? The sense of community and people being there for each other is a critical part of surviving and thriving.
Get smarter faster.
Okay. Sorry for all of the email sounds that I kept getting in the middle of that. I had to shut my inbox off. Let me switch back to our PowerPoint here. All right. So I love that video. I love being able to hear from the author directly. I think he did a great job, sharing his own experience, but he summarized a lot of. Am I back again? Okay.
You're back.
He's summarized a lot of what he talked about in the book. So if you haven't read the book, I hope that was a great introduction for you, and you feel free to engage in discussion today too. Okay, we're going to start with just a handful of questions, and I think I'm going to take the first one here, which is about how might constantly elevated stress hormones impact an individual. So if anybody else in the group would like to discuss what they think about this question, feel free. Otherwise, I have some thoughts to share too.
You can chat in or speak up too. Either way is fine. Gina says high blood pressure.
Yep, absolutely. A physical result from the elevated stress hormones, for sure. Health issues, weight fluctuations. Yes. Sleep interruptions. That's a big one. Sleep's so important for both brain and body. Depression. Absolutely.
I'm thinking even, higher risk for diabetes with the cortisol levels, concentration issues, digestive issues.
Yep.
Absolutely.
Thank you. You guys are on a roll. This is great.
Yeah.
So agoraphobia. Yes. So in the book, Dr. Vanderkolk really used a lot of stories to talk about patients that he had worked with over many decades that led into him doing a study of some sort. So coming from research, it's like super impressive because he's like, oh, new technology. What's this MRI thing? I bet we can use it to learn about trauma. He's just like wired to like study this. It's amazing how his mind works. So he told a story about a woman named Marcia, who was in a car accident that killed her 5-year-old and the child that she was pregnant with at the time. And she was experiencing after effects of that single incident many years later it had happened over 13 years ago. And so he used this new brain imaging technology to further understanding of how the brain and the body work together to understand trauma, and actually had her in an MRI, and they played an audio recording script of her traumatic experience. So they had interviewed her and gotten all of the details about this event that had happened, and of course got her consent to do all this. And in the MRI, the participants they studied that listened to their own traumatic experience being replayed out showed very different brain imaging results than participants who had not experienced trauma. And what it highlighted was this complete change in, it showed activation in the limbic area where the amygdala is, that's the fight or flight area, the visual cortex, and then Broca's area, which is important for speech. And so what this showed is this continued stress and reliving this trauma actually changed their brain and what parts of the brain were working. And so it really shut down the left part of the brain, which is that, logical, linguistic, sequential, analytical part of the brain. And the right side of the brain was activated, which is very emotional, sensual, tactical. And it really actually mimicked the effects of a stroke when it came to the speech centers of the brain. So it had that physical effect on their brains of stroke survivors, the same sort of physical effects. So even if they're able to talk about their trauma and they know they are traumatized, the body has that physical manifestation of the event in it for a long time until it can be resolved. So I thought that was really interesting that we may be able to talk about our trauma in a way that's logical, but our bodies are not able to make that logical sense still, which is very interesting and a little frightening as well, that you just don't have that control, of course. Any other thoughts on this?
Yeah, I have a thought. I remember before I read this book, I was thinking, or we were talking a little bit about the ACEs study, and we understood from the study that childhood trauma has long-term health risks. So it's an independent predictor of risk of heart attack and stroke and hypertension and all sorts of long-term problems. And it was just fascinating to me because I thought at the time, well, now what do we do about that? So these events have already passed, and there's nothing we can do to change those events from having happened in the past. But reading this book, it was interesting. It was so interesting to understand that there is actually a physiologic basis for that increased risk, and that you can mitigate that risk with certain types of therapy. And so I thought that was just kind of, frame shifting for me, to learn about that. So just my thoughts.
Yeah, thank you.
Laura says, thoughts about the person who's experienced a trauma but does not have anyone there to offer or give support. Yeah, no, exactly. I think if you experience a trauma but don't have access to the help that's needed to kind of rewire your brain from that, the cockroach brain, or he calls it the reptilian brain in the book. If you don't have the tools to rewire that, or you don't have that emotional or social support around you, then those risks just remain. Those constant elevations of stress hormones just remain. And it's extremely difficult to break that cycle.
Thank you. Gina, I saw you had your hand raised. Did you want to comment?
I just, full disclosure, I did not read the book.
It's
So
okay.
this might come up later, but I know, like we talked about, your body will be experiencing these things until they're resolved. Does he talk about like how to resolve them or things like that?
Yeah, so we will talk a little bit about that in some of the last discussion questions, but we're not going to get nearly as in depth as he does in the book. The whole last section of the book, he talks about a wide variety of different techniques and treatments that are outside the typical like pharmacological treatment or the talk therapy types of treatment. So he's got a whole range that he has studied over the years. We're going to talk a little bit about yoga that Dr. Peterson assigned me as a question. And then, but there's a wide variety in the book. So if you read one section of the book, like that last part with, now what can I do about this, is really helpful. Anna, did you have your hand raised?
I did, and then I forgot to unmute. I just want to say I did read the book, but I ran out of Spotify free listening time at the epilogue, which was a real bummer. But I also have it in print, and I like what you were saying, Dr. Peterson, about the kids. Because for those of you who know me, I work with moms and babies and kids. And I thought it was really cool just to talk more about the ACE survey, and then also, or the ACE study and the score. And then also just like, what can we do going forward to make things better? And it makes me think of like the way that my grandma and my parents handle things, like just go deal with it, versus what this book recommends towards the end, I thought was really interesting.
Yeah, thank you, Anna. And yeah, you work with an especially vulnerable population for sure. Definitely a different approach, more modern approach can be taken for sure. Michael, you have your hand up?
Yeah, I was just interested with how differently people react or interpret a situation. One situation can be horribly traumatic for one person, and the other person, it doesn't affect them at all. And so anyway, that just kind of fascinated me through this. But I do like the different therapies of focusing on the biological or physical responses that somebody gives, instead of just medicating them through it or talking about it over and over, which doesn't seem to do any good. So I don't know, very interesting stuff. It actually made me look into a doctorate for behavioral health. So I'm kind of scoping that out now.
Wow. That's
Very
great.
cool.
Yeah.
Yeah, so there was a one chapter where he described some of the experiences post 9/11. So he knew people, he worked in around the Northeast, and he knew people living in New York at the time, and he met with a family, friends of his, who were right there at Ground Zero, had kids in school there that day. And he talked about the differences in, some of the survivors and the trauma that they had experienced versus the child of this family who had, within the first 24 hours, like drawn a picture of the Twin Towers, but he had like put trampolines at the bottom so that he could prevent something like this from happening again. So his brain was already processing through how to recover. And people are very different, and often it has to do with what they're physically able to do as a result. So he was able to escape, whereas many people who experience trauma are not able to escape from the situation, and that can often have a big impact. The other thing I thought was interesting was that he talked about the absolute death of imagination for trauma survivors. So they lack the imagination or the creativity because of their change in their brains and how it works to be able to problem solve out of the situation that they're in, or imagine something different for themselves. And that's another reason why some people experience it differently than others. So let's talk a little bit more about the ACEs study.
Yeah, so this one's for me. Why do you think the findings of the ACE study have had little effect on our country's understanding of mental health and approaches to mental health treatment? And I think this is a really complicated question, probably with a lot of different facets to it. And I can only speculate because this is something that my entire knowledge of this topic comes from our last inclusive care lecture and this book. So I can only speculate based on that. But I think just from the kind of journey that I've taken from listening to last month's topic and reading this, I think a big part of it is the DSM criteria. So he talks a lot in the book about his efforts to include trauma into DSM criteria or categories, new categories for trauma. And being there being a lot of pushback against that. And my understanding of the reasons for the pushback are based on financial circumstances. So medications, including antidepressants, are many billions of dollars of an industry. And I guess the industry probably has some sort of impact on what goes into these particular codes, into research, into what is delivered to prescribing doctors. So I have to say that probably has something to do with it. And he talks a lot about how the medications are great for depression. They're great for anxiety. But if you have depression that is associated with a past history of trauma, you successfully kind of blunt those symptoms and that response to that trauma, but you don't actually treat the underlying disorder, which is probably why some people can take antidepressants for a few months or a year or a couple of years and then go off of them. But other people can take antidepressants and feel a little bit better for a while, but once they go off of them, everything comes back and they don't work. And so I have to think that has something to do with it. I also have to think that politics probably has something to do with it, with the access to social support in our country. And probably, I would say, we listened to a clip of a woman who, and I'm blanking on her name right now, which I should have at the top of my head talking about this, but the woman who talked last month in the inclusive care lecture, we watched a clip of her TED Talk. And she talks in that video, a part that we weren't able to watch last month, about how common trauma is. And so when you talk to a group of, like an audience of people that are, you talk to them about trauma, the majority of the audience has experienced that trauma. And I think people don't necessarily want to identify themselves with their patients. And I think that also is probably a bit of a barrier. So those are kind of my little thoughts on it. I'm sure people with a lot more knowledge of the topic have other thoughts. So I would be thrilled to listen to what everybody has to say about it.
This is Brandy
Jennifer
from,
says-
oops.
Oh, yeah, go ahead. Sorry.
I was going to say, I really feel like stigma has a huge piece in not taking this. I mean, I think when I think of inpatient and we try to do a trauma-informed approach, there's many times where we have to really cue each other to thinking about that. Like if we have someone that's, you know, really somatic and constantly has physical complaints, you can get wrapped up in, man, you know, this kiddo is always on, you know, always has a headache or whatnot. And then when you look at their trauma history and the abuse history that's went through it, then you kind of can be cued in to say, wow, this is a trauma response, right? They're trying to get a different need met, or their anxiety and their feelings are coming out in a physical complaint way. But when you think about women, and especially young girls, being 1 in 4 sexually assaulted, and considering that only about 30% of those actually report or do anything about it, there's so much trauma and feelings of like I did something wrong type things that I think until those break down, you're not going to get the benefit of all this research. You know, we're in the tiny little infancy stages because there's so much stigma around that and reporting and talking about it.
Exactly. Jennifer James said the most effective treatment is usually both antidepressants and counseling. The go-to for many people is taking the medications, and that's not a fix in and of itself. Laura said it's really bad for those who have been raped and report it only to get retaliation in response. Yeah, exactly. And I do think, you know, it is certainly easier. I mean, easier is probably not the right word, but it's much more straightforward to, even as a patient or a person who's suffering these symptoms, to go and get a medication rather than, and if their doctor isn't informed about, you know, treatments for trauma, or even asking about treatments for trauma, they're not necessarily going to be aware to ask about a history of trauma and offer the treatments that might actually be beneficial for the underlying disorder. Someone has their hand raised.
Yeah, so just to kind of go along with that, when I was working at a GI clinic in another state, the doctor that I was working with had a patient that was coming in for some GI concerns and could just never get to the bottom of it, no matter what he asked, no matter what they tried with, you know, diet, medications, and just her behavior was a little off. And finally, one day he asked her if she had, and she had never divulged that she'd been abused or had any sort of a trauma. But finally, one day he asked her if she had ever been abused, if she'd ever had that anything happen to her. And she denied it and clammed up and then would not come back to see us again. And so, you know, whether or not something actually had happened in her past, you can only speculate. But I think that's one thing that makes it difficult too when you're trying to do trauma-informed care, but you don't know if there was a trauma, and patients aren't willing to, you know, going back to, you know, maybe it's the stigma, but they're not willing to open up and share. And they don't realize how many facets of their health that impacts. So that was it.
Thanks, Allie.
No,
Absolutely. I see Sherry has
Yeah,
her
and I
hand up
think
also.
I think there's a big part too about you know, people don't want to be seen as crazy, or don't want to, like you said earlier about the stigma. They don't want to be seen as, you know, the mind is causing all of these physical symptoms that I'm having. Like that is not something that's kind of accepted in our culture, I think, which is definitely to our detriment.
Yeah, it would be
Sherry?
hard to hear. Yeah, it would be hard to hear that, oh, it's all in your head. That's why
Yes.
you have these
Yes.
physical. Yeah, that has to be incredibly frustrating. And awful to recognize that. Sorry, we keep interrupting people with their hands raised. Sherry, go ahead.
Can you hear me?
Yeah.
Yes.
So I think one of the items I've noticed is where they can miss the mark, is we often focus on trauma being abuse or physical abuse. And I had a clinician, because I struggle with anxiety disorder, who brought this home for me and said, I don't think you realize you are impacting, this is impacting you because of a trauma. And the trauma I had was I was a 2-pound baby with severe asthma from birth. And over my childhood, my parents would have to take me to the hospital turning blue. And the treatments were always very negative. And that I don't think is always taken into consideration, that sometimes those treatments or those conditions are creating a trauma that we don't always necessarily look at as trauma, but it does impact us.
Yes, absolutely. Thank you for sharing, Sherry. Michael?
I was going to say, he pointed out that a lot of the trauma stems from your safety network that you have when you're, during the experience. And I think that sometimes we miss that in that, especially from a man's point of view or male people that have gone through trauma, whether it's, vets or whatever, is they just don't see the areas that are offering help as a safe space. So it's not like a lot of us will walk into a hospital and think this is where I'm going to get help. And so the avenues for, where they're going to deal with it is a lot of times outside of a medical setting, maybe a close group of friends or things like that. And then it really gets tough when those people that they rely on, maybe it's a grandparents or whatever, pass away and they don't have a way to replace that. And so you kind of see a lot of vets and different people kind of spin outside the system quite a bit.
Thank you. He did talk a lot about his experience, Dr. Vanderkolk, when he first started. He first started as a psychiatrist working with Vietnam vets. And he said that he wasn't able to make any headway with them until they had accepted him into their group. So he had to create that safe and trusting relationship and really become one of them in order to be seen as somebody that they could share with.
Yeah,
Okay.
yeah. And I think you can't just walk in and have that relationship with a patient. It's something that you have to develop over a very long period of time. And he talks about that a little bit with a few of the patients in one in particular that I think it took like a year before she was finally able to trust him. And that's a psychiatrist. I mean, what hope do a GI doctor or a nephrologist have to make that kind of a connection with a patient? I think we all should be learning a lot more about this in our training. So there was a couple comments here in the chat. Michael Russ says the ACE score totally misses the example that Sherry gave. So, I mean, for all the benefits we have from the ACE study, it wouldn't include what Sherry's describing. And that, I think nobody could argue that that's very traumatic, that experience, to go through that. And Gina says, I wonder if people who don't like their feet touched were NICU babies because we poked their feet to get lab samples. Yeah, absolutely. And Denise says, how do you help those with disabilities? Does ACE cover that? They may not be able to reflect on what they are experiencing. Yeah, and Michael says it does not reflect on ACE. I think that would be next to impossible for somebody with a disability to fill out. Next, we're moving on to the next question.
Yeah.
Yeah.
So much great
So why
discussion.
is it Sorry.
So there's just been so much great discussion.
I know. I'm so excited. Yeah, this has been awesome. So, and this is, you know, basically what we're talking about now. Why is it pertinent that we treat both body and mind in survivors of trauma? I think it kind of goes back to that reptilian or cockroach brain that he's talking about. As soon as you get a trigger that puts you back into that mindset of I'm not safe, or whether you live in that space where I'm not safe all the time, like that's just where you reside all the time. I think there's no way to really address the root of all of, you know, the physical manifestations and life manifestations, and you know, even to that cycle of poverty and access to healthcare and social support. This experience of trauma and kind of relying on that reptilian brain response until you get to that breaking that cycle, none of these things are going to change. And putting, you know, starting a medication or doing talk therapy alone doesn't break that cycle. And he talks a little bit about like cognitive behavioral therapy, which I have to admit was really the only kind of therapy I knew about prior to this book. I'd heard a little bit about EMDR and a couple other things, but in theater, but nothing explaining why or how those things worked. But talk therapy, I mean, you can see after reading this book why that just wouldn't work. It would just be, you know, re-experiencing that trauma over and over and over again as you talk about it, but yet not rewiring the brain to have a different response to the stimuli that you approach in a day-to-day basis. Anybody else have comments on those, on treating the body and mind, different types of therapies?
I think kind of reflecting on Sherry's comment and some of the other stories that they had shared in the book about children who maybe had absent parents, or parents that were traumatized and did not get cuddled very much, or did not get rocked or attention when they were children. That is a type of trauma as well. And that you're out, he talks a lot about how humans are very physical beings and social beings, and without those connections the body is sort of isolated, and it just floats independent of other people, and without reconnecting physically to the rhythm of life, that you can't get out of that mindset. So he talks a lot about he threw a ball back and forth with a young child who had been very having a lot of emotional outbursts, wasn't engaging, but just that simple rhythm of throwing a ball back and forth and having that physical and social interaction helped that child to open up. And so I think that thinking about how you start with the body in some cases can change how the mind then is able to process too.
Yeah. Denise Hard says EMDR is amazing and really works if you have the right clinician that knows how to perform it. I thought that was just a fascinating form of therapy where you don't even have to talk about the trauma at all or bring it up at all. You just do this EMDR and it fixes that kind of physical response that you have to external stimuli. It's just fascinating to me. Michael Russ says, I've heard several behavioral therapists recommend EMDR because of the success that they've seen, even though they don't fully understand how it works. Yeah, same. I don't get it. I know he talks about how it corresponds to REM sleep and dream and that kind of imagination, but it doesn't make sense to me. I would have to do a lot more investigation into it, but it apparently works really well. Um, so
I put the rest of our
Elizabeth, do you want to take?
questions. Yeah, I put the rest of our questions up because we're just very quickly running out of time, which is
Yeah.
wonderful. It's
Yeah.
a great problem to have. So I think we've talked a little bit about moving away from therapy that solely talk focus, but how we would educate others about the mind-body connections. So what would we do differently, I think, is the question as a result of reading this book. And so I had the question number 5 there, and one of the things that I was thinking about is for people who really need evidence around this, there is a lot of research out there, and Dr. Vanderkolk was really involved in quite a bit of this, that there are really great alternative therapies to talk therapy or pharmacological therapy that can be very, very effective, like EMDR. And there were many others discussed as well. So he talks about like being in a theater group. He talked about brain computer interface technologies. I'm going to talk about yoga here in a second. There were so many other things that I think supplement all of the really amazing other therapies that are available. But the story that I was coming back to was there was a woman named Marilyn who had invited a man to sleep over, and in the middle of the night ended up attacking him because she felt his body move against hers in bed, and it surprised her and she lost all of her control. And through many, many sessions, Dr. Vanderkolk, working with her, asked her to describe her childhood, and she said it must have been happy, but everything that she drew, pictures of her childhood, clearly pointed to abuse and incest. So our minds may not even comprehend the trauma that we have experienced, but our bodies do. And so I think that's, again, why the book is called The Body Keeps the Score. It's there. It's written in our cells. And we have to be aware that sometimes the things that body memory, sometimes the things that we physically experience are not only physical and are driven by the things that are going on in our brains or the trauma that we've experienced. So he talked a lot about helping them reconstruct their inner map of the world. So people who don't even recognize that they have had these traumatic experiences or have blocked them, don't remember them in their brains. You have to help them reconstruct that perception of the world out there and reorganize their central nervous system, essentially. And it can take a really long time. Which is too bad, but there is treatment available for sure, which is good. And then I'll just talk about the last one. So HRV is heart rate variability. And I think I got this question because Dr. Peterson knows I just started doing hot yoga in the last month or two. We've had discussions about would we or would we not like to do hot yoga? So it's clearly not for everybody. I don't think it's for Dr. Peterson. Doesn't seem like it's up her alley. And I originally didn't think it was up mine either. But when I started going to hot yoga, I felt powerful. And that's the only thing that I could use to describe it. I felt amazingly in control of my body in a way that I had never experienced before. And so yoga is one of the techniques that he uses in treatment. Heart rate variability is a biomarker. It's relative to your kind of like your normal experience and then your fight or flight. So getting in between those, your heart rate variability, if you have not experienced trauma or you're in a sort of what we would call a normal state, your heart rate, you're able to control sort of that initial fear response to certain things. But those that have experienced trauma have a wider heart rate variability, and they don't have that same sense of control over their physical response to certain things. And so yoga is a way to reconnect your brain with your breath, with your body, and learn and relearn control over how you respond and react to certain things. And so when I read about this in here, uh, yoga for me, it does that. It gives me that sense of control that I didn't maybe have before, and didn't know that I was lacking. So I think that's why I feel so good doing it, even though I come out really gross and sweaty and it's kind of yucky. It's amazing for me. It's not for everybody, but it could be a thing for you. But I see other people here in the chat are saying, Anna's in, so I'm going tonight, Anna, at 5:30 across the street at Beautiful Yoga, if you want to come. And then Gina feels that way about bar. Anna also likes kickboxing. Owen mentioned that EMDR was life-changing for him in dealing with childhood trauma. That's awesome to hear. So I think the key here is finding the person that you can work with that can help you understand this, and finding the right therapy or the right type of treatment for you in your unique situation. And it's just going back to that, treating every single patient, every single person as an individual with that incredibly complex life experience and background that they bring with them to every interaction.
Yeah.
Dr. Peterson, anything
I think
else you would add?
Yeah, he actually does talk about kickboxing in the book, and I think you read it, right? Yeah, he talks about prescribing kickboxing to some of his patients to kind of regain that sense of control and strength. And he talks about the self-defense classes that women really, some of his female patients had responded really well to. And I think I had thought about giving some recommendations or highlighting some local therapists who perform some of these, but I haven't had a chance to vet any of them, and so I just wanted to make everyone aware that there are therapists in the area who provide all of these types of therapy, theater, neurofeedback, EMDR. They're available locally in our community. So just if you do a Google search, you can find them. So
Thank you. So as we close here, we'll just take any last comments or questions you have. And then I will just also add that in addition to local resources outside, I want to remind everybody about the resources we have through our EAP, Vital Work Life. They are able to connect you with therapists. They don't have any therapists that work directly for Vital Work Life, but they can get you connected, and you have a certain number of sessions available to you every year for free as part of that EAP. And then I will just also say that we have lots of great people here internally, many of them on this call, who are always willing to lend an ear and help you find those resources as well. So Dr. Peterson and I are co-chairs of Caregiver Wellbeing. Jennifer James is our manager of chaplain services, and there were several other folks on the call here who I know a lot about what resources are available either here at Kootenai or within the community. So please reach out if you ever feel like you need assistance with that.
thank you for that.
All right. Thank you, everybody, so much for coming. It was a great discussion. It sounds like this was a really great topic to select. I'm glad that we did. And you can let folks know if they missed it that it'll be posted on kh.org probably in the next week.
Yeah, thank you everyone for your comments and for participating.
Have a great day.